I'll try to honor those great messages by helping all of us to know a little bit more about social anxiety in a way that can be useful to you in your agencies and in your practice. Try to give you some facts and also just a general sense of this condition. So Larry is talking about something that I think really separates, as Jeff said, the kind of shyness that most of us get in our life versus the kind of shyness that we think about when we talk about an actual mental health disorder. And one of the biggest issues we have in social anxiety is many people, young people and people as they go through their teen years, their social anxiety is just dismissed as shyness. And it's sort of thought of as a personality trait and something that's unchangeable, even in some young people, kind of a cute thing. But when you think about what defines a condition, what really defines a mental health condition, as we all know, is functional impairment. How much does it interfere with your life? And if we were to kind of do a poll, if we had a little chart here, and we started, kind of writing down the things that matter most to all of us, I suspect we come up with 4 or 5 commonalities. In the end, some of us would mention our work as being important. Many of us would mention romance and friendships and the things we like to do for fun in our relationships with our family. Those are probably the things that matter most to us. Now, everybody's got a little different order on that list, but those are the things that matter. And if you have generalized social anxiety disorder, this kind of fear of interacting, this fear of scrutiny of others, and it's in most social situations, it's probably very likely that all 5 of those major domains are interfered with. And you can see in Larry, who's probably around 50 at this point, that it's affected a critical area of his life, and that is his ability to make a living. A lot of the research that I do, which you'll see a little bit about later on, focuses on this problem that you see a lot. You saw it with Andy, this difficulty finding and keeping employment. You just don't realize, really, how much of your social skills and social comfort you call upon in order to find a job. I would imagine that most of us found our job through some word of mouth. Well, in order to have word of mouth, you need a network. And you need a network of people who are confident in you. They're willing to put a word in for you. It's also really important if you get a good education. It also really helps if you go to the job interview. Really, really helps if you do a pretty good job at the job interview. And especially since most of the jobs in our economy rely on your social capabilities these days. Not so many factory jobs where maybe being shy is an advantage. You won't organize the union, and after you get done eating lunch, you'll go back to work. These kinds of social jobs in our current economy, those that are kind of more interpersonally focused, are the hardest kind for people with social anxiety. And we see that here in Larry. He's tried all sorts of different careers, but he hasn't been able to really make his way because he said he was a little bit timid. Well, that's his word for being really worried about how other people think of him. Worried so much that he avoids them, or if he does come in contact with people, he cuts it off really quickly. Now, I don't know if that's exactly the case. He might have had a few people he could talk to, but it's pretty clear that Larry talks about something that's very interesting when it comes to social anxiety. And of course, other mental health conditions we're all aware of, like major depression, substance abuse, psychosis, whole range of conditions. Those are highly important problems. But one of the difficult parts about social anxiety is it starts out very early in life. It has a very early age of onset. For him, he said something about his teen years. He was probably shy from the time he was a toddler. This is the kind of condition that is usually present over a decent part of a person's life course. The average age of onset where the disorder begins, and that's where the functional impairment begins, fits perfectly with Larry's story in those early teen years. But what happens is that a lot of development has to take place during these years when this condition is present. For instance, if you get major depressive disorder, which is obviously a very difficult condition and is absolutely worth our consideration, often it might start in your 20s or 30s or 40s or 50s. You've established a lot of your life milestones by then. But this is a condition that interferes with life milestones. And we're hearing about that from Larry. He's beginning to talk about not only his work impairments, but he's talking about his school impairments. And he's also talking about his ability to interact with other people. I was at dinner last night and met a new person, reacquainted with some people that I know, with all the folks you've heard from today. And when you go to a dinner like that, well, you like to try to say things that are reasonable, not make a fool out of yourself, try to get along. And in order to kind of manage in those situations, you don't realize how many skills you call upon. Like when it's your time to talk and when it's someone else's time to talk. What you should talk about, how long you should talk about it, how close you should sit to someone, how loud you should talk, how do you change your cadence to make it a little interesting. All of those things have been shaped, those social skills that you take for granted have been shaped over your lifetime. But if you've been avoiding people most of your life, then it makes it a little harder. So not only is the fear there for people with social anxiety, at least those who have social anxiety related to most situations, it's also often a skill problem. It's an elegant set of skills. And if you've made a friend, let's say, so a new friend at this conference, you really did call upon a lot of nuanced capabilities in order to make that match fit. And for people with social anxiety, they're often in a pretty vacant situation. They don't have a lot of relationships. Andy did early on, which was great. He had that sort of ability to interact with his peers pretty well, but it sounded like it began to erode. Larry doesn't sound like he ever had much of it. But that skill development is a significant problem when you've been avoiding things over and over again. Like if you tried to take up tennis, let's say, and you didn't know what to do, and no one showed you, and maybe you held the wrong side of the racket, and you didn't play very often, you wouldn't be a very good tennis player. I might submit that socializing is much more complicated than tennis. But if you don't have good role models and you don't practice a lot, you just start leaking a little oil. And other people see it, you might feel it, but you don't know how to remedy it. And I think that's what Larry has had most of his life. I suspect that Larry, because there is a genetic component to the etiology or what causes social anxiety problems, and I suspect he's got a lot of shyness in his family. But that isn't always the case. But I think Larry's gone into a tough situation, and that is trying to make friends, interact with people, with probably not the greatest role models for doing it. They probably didn't have a lot of neighbors coming over for picnics or a lot of interactions with family. They probably didn't practice a lot of that. And it probably his parents might not have been super social people either, although sometimes that's not the case. So Larry's been suffering for a long time, and we hear about his friendships, we hear about romance, and we hear about work. So this brings up another interesting point that Larry reminds us about, and that is social anxiety is associated with a lot of other conditions, and it tends to be the first problem, and then substance abuse and depression usually happen later. So when you find someone with generalized social anxiety and they're in their 30s, chances are pretty good they've had a substance abuse problem, almost always alcohol, and chances are pretty good they understand what major depression is by then. There's been an interesting amount of research trying to think about where we should put our healthcare dollars. You know, we've got only so many healthcare dollars. What mental health conditions would you put it behind in order to get the best return on that investment? Well, this is a condition that actually makes a ton of sense to treat early. Because of this cascade of comorbidity, this addition of substance use problems, and we'll hear also about depression, we certainly heard about that with Andy, that this is a really potentially very powerful problem to identify and address early. So Larry's clearly suggested, one of our most innate drives is to find a partner. And a lot of people with generalized social anxiety disorder end up without a partner. It's hard enough for Larry to talk to someone of the same sex. To talk to an opposite sex person was very difficult for him, and let alone to begin to talk to them in a way that suggested you're interested. Because really at the core of this difficulty is a concern that you'll be scrutinized by others and found wanting, right? And there is no place where you're kind of more under the gun when you maybe ask someone out for coffee or you think about a date, because at that moment you might get a yes and you might not, you might get a no. And a no for somebody with social anxiety is really quite a bit different than a no for people who don't have so much social fear. So a no for Larry might lead to a year or two of rumination about it, and a sense that I'm not going to go back to that again. Whereas most of us, if we try to talk to somebody and it didn't work out so great, we dust ourselves off and move on. And maybe we're hurt a little bit by it, but it is somehow our brain lets loose of it. Like maybe if you ask someone out on a date and then maybe the next day you thought about it and you think, oh, that was so awkward, and maybe the next day you have a thought about it, and then you might go months and you might think, oh, I never really thought about that. That's right, she did say that she didn't want to go out with me. All right, well, I'll go on about my life. But for people with social anxiety, one of the difficulties that they have is that these social interactions they can't seem to dismiss them very easily. So old social interactions that don't go well, they try to dismiss them. It's like they want to kind of gatekeep their thoughts. I don't want to think about that anymore. I'm going to go on to think about something else. They remind me of my obsessive-compulsive patients, and that is to just have a lot of trouble letting loose of that trouble. And if it haunts you enough, you might start to think, I'm just not going to take that risk again. So I think you can hear in Larry that depression. I do think that it wasn't, our bodies evolved in small hunter-gatherer groups in a whole other region of the world. Our bodies are old, our lifetime has been very short, and we're really built to pay attention to how we're getting along with others. If you were in a small group, which is living in the African savannah, and that's where your body developed, if you got cast off from the group, you were dead. You were not in the situation like you might be able to be in today where you can kind of get along on your own. You needed that cluster of people. So getting rejected was in some ways, in most of our developmental time, it was close to a death sentence. So we have brains that are programmed to pay attention to how we're doing with others and for us to feel bad about it if it's not going well. So we've learned a lot about social anxiety from Larry's story. We've learned that it interferes with core areas of function. We learn that it starts early in life. We learn that it elevates the risk for later conditions like substance abuse problems and depression. And we also discussed that most people over his lifetime wouldn't have thought it was a problem. But as the days went on, it's been a really difficult time for Larry. Larry finally got some good help, and it made a big difference in his life. And it's one of the most positive parts about social anxiety disorder is that we have really good treatment. We're going to talk some about that today. But also, that's the upside. The downside is we have almost no practitioners who are prepared to deliver it. Almost everyone with social anxiety won't offer it up as a presenting complaint. They'll talk about depression, they'll talk about substance use, but they don't really talk about they don't come and say, I have social anxiety, will you help me? At least not for a long time. I do think more people know about social anxiety now than many years ago. And it's an interesting kind of a twist. I would say if we think about one organization that might be most responsible for awareness about social anxiety, I might say it's Glaxo Pharmaceuticals. And I don't write prescriptions, I don't work for them. But one of the things that they did do is they tried to sell a lot of pills for social anxiety disorder. And actually people were very angry about it in some circles. But I have to give them one thing. They certainly did get a lot of television spots talking about social anxiety, bringing a little awareness to it. And I think, frankly, our organizations like psychologists, social workers, psychiatrists, we really haven't been paying much attention to it. We haven't been doing a great job in bringing awareness, frankly. So an organization like the Kukas Foundation fits a niche that has yet to be ever developed, and that is someone to shine the light on this problem. So it's a little easier for people to talk about it when they go to see their physician or a counselor. So family members might know more about this condition so that they could refer a loved one and think about this shyness a little differently. So this is a problem that mental health professionals haven't talked much about, but we should have. And I'll try to show you a little bit more about why it's worth our attention. First of all, social anxiety disorder, I think all of us know what this concept is. It's a fear of and avoidance of social situations. People with social anxiety disorder avoid situations or endure them with a lot of dread. Most people with social anxiety disorder, they see the fear as excessive or unreasonable, but they just can't stop their body from being worked up. And that's the interesting part about Larry's story. When you heard that he went to a flunk out, from a flunk out to honors, when he got all those degrees, and he thought, oh, once I get those things, then I will be okay because I'll feel confident. But it's like the primitive part of his brain wasn't listening. I mean, I could just see, the frontal lobes are like, hey, I graduated college, I did well, I graduated with honors, I should feel more confident. But it's like his limbic system isn't listening. It's like the dumb guy in the furnace room doesn't want to hear anything about it. And when he gets around people, the heat gets turned up again. So it suggests that social anxiety disorder has kind of several components. How you think about things, for sure. How you live, but probably something a little built into. That doesn't mean that our treatments have to involve medicine, but it does suggest that our treatments involve really paying attention to two parts of your brain. Your thinking part and this sort of limbic system, more primitive part of your brain. And I think you'll see that cognitive behavioral therapy addresses both. But clearly, this idea of a continuum, a lot of us have social anxiety. Many of you would not want to spontaneously trade with me. Or if I decided to do a little social anxiety probe, and I asked each one of you at random to stand up and sing your college fight song, I suspect that most of you would be hoping upon hope that you wouldn't get picked. Now, if I asked you if you actually did stand up and sing it, would it really hurt you that badly? Oh, you'd probably say, no, it probably wouldn't hurt me so badly, but I sure don't want to do it. All of us know that there are performance. I picked singing because a lot of you are probably public speakers, but probably very few of you are singers. So if you had to stand up and sing, you'd probably be really nervous about it. But let's just imagine if you sang and sang and sang, and we were all paid to stay in the room here together, and you sang that fight song once, twice, we get 3-4 hours into it, I guarantee you, all of us will be bored, including you. So we know, we all have some kind of way of noticing that there are certain circumstances that cause you anxiety, interpersonal anxiety, but there's a way of kind of overcoming it. One way of overcoming it is to practice it a lot, like the singing over and over again, and you have other ways to overcome it. In many ways, our treatments for social anxiety disorder, which you probably know something about, are relatively straightforward. We'll talk a little bit more about that down the line. So, since they're not going to they're not going to tell you about their social anxiety, it's nice to have a few questions to ask. Are you afraid of speaking in public? Do you avoid social events? Do you fear being watched closely while doing something? Are you afraid of embarrassment? Do you flush or sweat really easily? I think this flushing thing is a very interesting part of social anxiety disorder. I've been working 30 years in the anxiety disorders program now, and I've had thousands of patients, and our clinic has had thousands of patients. But a lot of times people talk about these distinctions between one anxiety disorder and another, and it's not so meaningful. And I do think we probably get a little too caught up in these categories, to be honest with you. But one thing that's interesting about social anxiety is that when people have bad social anxiety, they often flush. They often get spotty in their chest. They often get sweaty. If you take somebody who's afraid of snakes or spiders, cats, dogs, they might look really afraid, but they're never flushed. They don't shake as much, usually, and they don't sweat as much. So it sort of suggests that not only does social anxiety have different triggers, but it feels a little different than other kinds of anxiety. And I suspect you've noticed it. Like when you've been worried and you got too much to do and you're worried about kind of general life problems, it feels annoying. But it usually isn't associated with flushing or shaking or sweating. But if you were having to sing right now, you might feel all those same sorts of things. And it suggests that there really are some distinctions from one anxiety problem to another. And sweating and blushing are particular hallmarks of social anxiety. And of course, does this bother you? Do you feel like your fears are excessive? Is it interfering with your life? Lots of different things that come up in social anxiety disorder, like participating in small groups. One thing that people don't think so much about is eating, drinking, writing in front of others, talking to authority figures. So the eating and drinking and writing is usually about shaking. Because I think half of social anxiety is about being afraid that you'll mess up either say the wrong thing, or you won't seem so intellectually together, or you make a mistake, or you'll seem awkward. That's part of it. But a big part of social anxiety is also fear of displaying discomfort in front of others. So messing up, making a mistake is part of it, but also just having people see that you're uncomfortable. And this shaking comes up with writing checks, drawing food up to your mouth, or writing a check, for instance, in front of a cashier, or signing a credit card receipt, performing and giving a talk, attending social events. Even using the public restroom is a real problem for some people with social anxiety. They get in there, and if someone else is there, they can't go. They can't urinate. It just won't come out. So there are a range of different ways it presents itself, but to understand social anxiety well, there's really two types. A specific subtype that's primarily public speaking or performing in front of others, and a more generalized subtype like maybe Andy was troubled with, or Larry, where most social situations are a problem. And those are the ones that are associated with depression, substance abuse, and lots of functional impairments. So we talked a little bit about this, the prevalence of social anxiety disorder. It's a highly prevalent condition, around 13% of the general population. And it stacks right up there with alcohol dependence, abuse, and major depression as among the most common psychiatric disorders in the U.S. Unfortunately, as we talked about earlier, social anxiety is associated with suicidality, increased risk of suicidality, most particularly when it's associated with another condition. And the big risk factors are for suicide are substance abuse and depression. And those two problems come often with social anxiety disorder. So you see a pretty high rate of suicidal thoughts and suicidal behaviors in people with social anxiety, and you wouldn't normally guess that. I want to talk a little bit about this, just talking a little bit more about the functional impact of social anxiety and why it's important to ask about it in your clinical work and develop a set of skilled practitioners in your agency. I'd really like to kind of focus on this part of the slide right here, this little one in the corner, financial dependency. We heard that in Larry's story, and we heard that in Andy's story, that making a living is a problem. We've already referred to some of those difficulties that social anxiety might bring in the workplace. But when you really look at this, people with social anxiety problems are very likely to have trouble making a living, whether it comes with other disorders or not. So just even standard social anxiety without depression and without substance abuse, still associated with about a 25% chance of not being able to make a living. So those are sort of the highlights about what social anxiety disorder is. I'm sure you've run into this in your clinical work. Maybe this is review. But kind of the high ground so far, an early onset disorder that affects the life course, that starts a comorbidity cascade, that interferes with the central areas of functioning, and in addition interferes with your social skills development over time. It's very common, and unfortunately people with social anxiety disorder often don't come for treatment at places like where we work, because I guess if you're going to go for a mental health or counseling evaluation, where you know what's going to happen. We even call it an evaluation in our anxiety clinic. I mean, it's an evaluation. And this idea that I'm afraid to go tell somebody that I'm awkward and socially afraid, you can see that people with social anxiety stay behind and they don't go. And you know, most people who come to our agencies have been urged by their family to come. But if you view it like, oh, that's just the way that person is, he's a shy person, then you're not likely to push them until you start to see the other trouble. Then you run into the problem that Jeff suggested, and that is when social anxiety becomes more and more part of your day-to-day life, you avoid more and more, you kind of become further and further behind in your social skill development, then it becomes a lot harder problem to treat. Because while you're avoiding, as a young person, while you're avoiding, all your peers are practicing and making a big transition in the way they interact. You can tell, a 16-year-old high school kid is often a conversation with a 16-year-old high school kid and a conversation with a 26-year-old college graduate who's working at some company. It's a totally different experience. But if you spent those years, those 10 years avoiding, you're not picking up on those new skills. Or you may not. There's always some naturally talented people who are very socially anxious. They avoid like crazy, but they got some charisma, they've got some kind of social skill in a natural way, but most have trouble. Any comments or questions? I always, hesitate to ask because I always worry that nobody will ask me one, and then I'll have social anxiety. But bless you, I'll take your question.
What about the presence or the co-occurrence of Asperger's syndrome or autistic disorder spectrum issues? It seems to me that there's so much overlap.
Yeah, I think there is. The question was, is there an overlap with Asperger's spectrum disorders, autism spectrum problems? And the answer to that question is, in some ways yes, and in some ways no. Most of our autism spectrum disorder clients, they're less afraid, but they're avoidant, and they don't know, they have trouble with people. It's not so much about the scrutiny and being judged. It's more about just an inexplicable problem getting along, making friends, connecting. Although certainly people with autism spectrum problems do have anxiety too. But I think one of the key elements, although sometimes it's very hard to kind of make a judgment here, so it's a great question because I find myself in those judgment calls a lot, but usually the people on the autism spectrum don't talk so much about the anxious arousal and the subjective fear. Usually it's their family saying they're lonely. They're alone, not lonely, but they're alone. And they're having trouble with people. In the back, and then we'll come up front. Great.
Yes. What about, say, like the introversion, extroversion personality types, like the Myers-Briggs personality types?
Yeah, you bring up a great point, because for me, does that mean every person who's, kind of on the more reserved side should get treated into becoming a stand-up comedian? Should we have some kind of a culture where we don't accept people who aren't gregarious, and anyone who isn't gregarious gets labeled as dysfunctional, and we ought to rehabilitate them? I'd say the answer to that question is no. I think there is absolutely a spectrum from more outgoing to just people who like to be more reserved. I think the key component here is fear at the center of it, and are there functional impairments that those folks want to overcome? Because I do think that there are some people who are just naturally more reserved, but they're usually not going to complain that they're super anxious, and they're usually not going to say, I really want to find some way to connect with others. I think one of the things about Andy's story that's so compelling is that he really wanted to do all these things, to live differently, but the fear was holding him back. Whereas a person who's kind of on that more reserved side, they don't talk about life in the same way. They have a narrower social circle, they might have a less interpersonally focused job, and they're all right about it. So I don't think we have to treat them all. Yeah?
As this condition is so prevalent, as you showed on there, why is it that mental health professionals don't look to this as one of the possibilities of a disorder when the patient comes in?
Yeah, you bring up a great question. What is the gap here? Since it's a prevalent condition, why aren't the mental health professionals more tuned into it? I do think part of it comes from the fact that they're talking about other things with their patients who are socially anxious. I think they get the sense that they're socially anxious, but they're focusing more on the depression, more on the substance abuse problems, because that's what the people talk about. Also, once you get going with the client, you start to build a relationship, and they might seem different. So the social anxiety isn't so front and center. When I've seen someone for 2 or 3 sessions, we're connecting usually, even if they're shy. It's just kind of an unusual, intimate situation. So I think that as practitioners start with patients, they're likely to be talking about things other than social anxiety. And when the relationships develop, they don't see so much of it, because it is this sort of intimate sharing relationship that's different. Okay, so why don't we spend just a little time now talking about treatment, and a little bit about why we have such a shortage of treaters. The last thing I would say is that cognitive behavioral therapy, which is the sort of the stock and trade of my day-to-day life, the kind of things that I research, it's sort of the approach to solving problems that I know best. And interestingly enough, it's what I learned best. A lot of us end up continuing to do pretty much what we did when we were getting started. Of course, we've all made some transitions and we make a little different in our clinical work, but really, the field of mental health, at least, we're not that great at actually changing practitioner behavior over time. People go to weekend seminars, but we know actually that a weekend workshop doesn't change the practitioner behavior for much more than a week or two after the workshop. We know that, but we continue to do that again and again. You know, if there's some new treatment, go to the weekend workshop. So I think our field hasn't adapted well to what it takes to train clinicians in a new treatment. And we kind of all usually sort of revert to what we kind of know. And it's pretty clear that some people with social anxiety are helped by treatment that isn't so specific. Maybe you'll talk to your clients about the origins of these problems and it'll help them. Or maybe you'll talk to them about their day-to-day issues and that'll help them with their social comfort. But we know that in general, people with social anxiety disorder, that those kinds of supportive interventions are not as helpful as they might be for other trouble. It sort of it reminds me of this sort of that kind of built-in capacity that you see in Larry, that it's always been kind of something about him that stirs up a lot of internal pressure when he's around people. So cognitive behavioral treatment is our kind of treatment of choice for social anxiety disorder, and it has two components that we all use in our day-to-day life. You, I'm sure, use it in your practice. So a lot of this I know is review, but let's just go over it a little bit. At the cornerstone, the centerpiece of social anxiety treatment, as I see it, is exposure therapy. This idea, can we practice what it is that we're afraid of? And in a lot of ways, 30 years in the anxiety clinic, I've spent pretty much most of my time asking people to do what they're afraid of. It's not really all that complex. There's just something built in to most of us, and that is if we're afraid of something and we do it enough, it gets a little easier. And it really helps if we do it in sort of a particular way. It helps if we practice it a lot, we practice it for a long time, and it's a lot easier if you go from easier to more difficult challenges. So if you were afraid of snakes, we could start with a child's drawing, look at the child's drawing from halfway across the room, then we can get up to the point where we get the child's drawing right next to your face, and then we could work up to a rubber snake and then maybe put a boa constrictor over your shoulders in the end. We could have started the treatment with a boa constrictor, but you might have run away. But if you did start with it, it would have been very efficient. But generally people don't want to sign up for boa constrictor treatment, and they don't like it, they don't continue with it. So we try to do this gradual thing. If we're going to do the practice with the snake, it'd be really nice if we did long sessions so your body has a chance to sort of calm down. What we're really trying to do with snake phobia treatment is to pair the snake with a calmer body state and sort of break this association between feeling all upset and being around a snake. And it works very well. So this concept of exposure therapy, as you know, we use in all kinds of things, from fears of heights to panic disorder to obsessive compulsive disorder. It is our benchmark. Our true north in anxiety treatment is to practice it. So we try to follow these golden rules in exposure therapy, like easier to more difficult, practice it for a long time, frequently do it, focus your attention, and try to end when the anxiety is better. The problem in social anxiety is that you need a partner in order to do that. And that partner might not be cooperative with the golden rules of exposure. So let's say that you're hitting a bad spot today. But let's just say that I'm a socially anxious person and I'm doing some exposure therapy. And, my clinician asked me to do some practice. You're sitting here in this conference. I say, okay, I'm going to come and have some practice with you. And I'm trying to follow these golden rules to exposure. So I sit across from you. And right away, one of our first rules is I don't know whether you're going to be nice to me or not so nice to me. So I can't really grade the difficulty of the exposure. You look nice. You look like you're going to be a nice person to me. So, you smiled and nodded when I've talked, so I picked you because I thought you would be okay with it. But I don't really know whether that's the case. So it's hard to titrate the difficulty of practice in exposure therapy for social anxiety like we can with the snake. So that's one thing. Secondly, if I strike up a conversation with you, I might get really nervous. And if I get really nervous, it might take a long time for my anxiety to come down. But you might not have time for that. You might, need to go to your next session. You might need, to make a call. You might have a friend you see across the room and you want to talk to her or him. So you might leave me before I can end this on a good note. I get in front of you, I say hello, I get really nervous, and then you have to break it off. Or it's always conceivable, even though you're a nice person, if I come up to you and I seem a little awkward, that might accelerate the separation between you and I. You might think, oh boy, I gotta check my email, or check your watch. They're really nice. Oh, or a friend goes by, hey, I need to talk to her. Thank you very much. So if I'm looking really kind of awkward and anxiety and very anxious, you might break it off too. So social anxiety exposure takes a little more creativity, and it also takes the understanding that exposure therapy is optimal if it's gradual. It's optimal if it's prolonged. It's optimal if it's frequent. But it's still pretty good, even if all the rules are violated. Because I at least got a chance to test out one thing. Was talking to you a disaster? Did I live through it? Was it unmitigated just collapse, or did I make it through? It'd be a lot nicer if all the golden rules were met. So we got to find some ways to do exposure therapy for people with social anxiety with this idea in mind. So let's talk about some tricks, some ways we do that. We have people with social anxiety disorder calling businesses one after another after another. First asking for their hours, then asking them to describe some of the products. So we're calling tire store after tire store. I've got a Camry, a 2007, I need tires, what would you suggest? So we have some conversations on the phone. Then we can even, do some things that are a little uncomfortable, like pick stores that are deliberately not open on Sunday and complain. Why are you not open on Sundays? Well, you're not open on Sundays, how come? And what is that about? I don't go to church, I would like to come. Then you could even make more blunders if you wanted to, like, and do you guys sell groceries over there too? So a little way to test out whether it's so tragic to flub up, and you can do this repetition again and again. So we're talking about products, we're visiting stores again and again. One of the places that can be helpful for somebody with really bad social anxiety problems is to get them out in contact with people who are paid to talk. So at a jewelry counter, looking at Rolex watches, you are not going to be left alone at 11 o'clock on a Tuesday. And there's plenty to talk about. Stereos are the same, diamonds are the same. So you have a chance to sort of interact with shopkeepers if that's a problem. So we would practice that. And maybe classes, Toastmasters, church groups, volunteering opportunities. One of the things we like to do as people get a little further along in their social anxiety exposure treatment is to send them out into naturalistic settings after these artificial ones are occurring. But we try to pick places where you're likely to run into nice people. So we love volunteering. Sending people with social anxiety to volunteer opportunities is really good. We particularly like volunteer opportunities where there's a mix of conversation, but there's also a mix of doing. So something like Habitat for Humanity is great. You can work off a little of that anxiety just by lifting some drywall around. You might be painting next to somebody throughout the day. So you can chat a little, paint a little, chat a little. It's a little easier. And there are often a lot of nice people at the Habitat for Humanity, or nice people at the Salvation Army. So those are, I think, really good places for people to get some more naturalistic social practice. They can do it regularly, they can do it for long periods of time, and they can sometimes polish up those rusty social skills. Because for some of our socially anxious people, once they get out there, they really go. It's like somebody who has a natural talent for basketball. You get them on the court a little bit, and all of a sudden they're doing great. And some, unfortunately, don't have a natural talent, and it takes a lot of work. So we work up all the way to things like coffee shops and restaurants and nightclubs and making invitations. This is one of the things that people with social anxiety almost never do, and that is they don't ask people. If you've made a friend, somebody made an invitation. They said, hey, I met you at where you've been talking at work, or maybe you met in church, or maybe you met somewhere. somebody had to say, hey, would you like to go, like if you're a guy, maybe you might say, hey, would you like to go play golf, or would you want to go for a beer after work? And there might be other things you might pick, but somebody's got to take that risk so we can practice those invitations that move a person from an acquaintance to a friend, because that's what socially anxious people need, is to start collecting some friends. So we try to put them around friendly people, practice casually interacting, and then take some risks on the invitations. And set some expectations that a decent portion of those invitations will be turned down. And it gives us a chance to work it with them from another angle too, and that's the thinking part of this problem. But it's clear that social anxiety disorder has a great opportunity for practicing social situations that are difficult. Excellent opportunity, but it is a little harder. It's difficult to carefully grade the exposure. Prolonged exposure is often difficult. People don't always cooperate. Hard to end on a good note. But it sure is a chance to test out whether it's so terrible to have an interaction with somebody that doesn't go well. But clearly, if you aren't naturally talented interpersonally, you can run into some trouble when you're trying to strike up those early conversations. And especially if you're getting, but you know what's interesting is that it doesn't, I mean, for adolescents, the rules are there. They're just different rules. And for grown-ups, there are different rules. And there are cultural variations in these rules about how to interact with people. And there are age-related, education-related differences. So it can get really difficult, you know, if you're not naturally talented, to know how to interact. So let's just say Carolyn, you're going to get it again because she's got tags on here, so she's probably involving in the organization in some way. So let's say that I come to talk to Carolyn, and I decide, hello Carolyn, how are you? Yeah, so Carolyn, you know, I could talk with you, I could say all the nice things, so tell me about what brought you here. And you might say something like, well, this is my conference, I come every year. But no matter how this interaction goes, if I continue to sit this closely to you, you're going to think there is something wrong with this guy. So it's just something so basic, is I got to get a little further away from you. So let's say I decide I'm going to ask you that common question, like what brought you here? That comes up a lot. But I pulled the chair way over here. And I said, so Carolyn, tell me, how'd you get connected with the conference? It doesn't work, does it? It's not quite right, right? So there's some subtlety here, isn't there? So I got to get the right distance. And I think Darwin comes into play again. It's usually just a little bit outside of arm's reach. That feels about right. If I came up about here, that would be good. Now maybe I'll ask you to go along with me a little bit, Carolyn. You didn't expect this today, but let's just say I ask you a standard kind of a question. So what do you think of Phoenix so far?
I've only seen the airport and the hotel.
Yeah. What do you think so far, though?
I like the dryness.
Yeah.
Florida was like,
Right. So I could ask you these kinds of questions. It's not bad to ask you there's nothing wrong with asking what you think about Phoenix. You just came here and getting your reflections. And I could ask you some follow-up questions. Yeah, the weather is a lot nicer, isn't it? So, but if I continue to stay this stiff, you're going to think this guy is something wrong with him. And if you think there's something wrong with me, then you're going to close this conversation off. Right, you're going to your friend. So not only do I get the right distance, but I got to move, right? So I said, okay, so you've never been to Phoenix before? Go ahead. Have you?
no, I haven't.
You haven't.
Yeah.
So you enjoy it quite a bit, right?
Guess what? I'm still going to
So I'm moving too much, right? It's weird. So not only do I have to get the right distance, but I also have to get the right position. I can't sit here like this, even though the chair is clearly designed for someone who sits like this. I got to get a little off kilter, right? And I got to be able to move, kind of. Not too much, not too little. Not weird movements, right? But I got to know some kind of social movement. I don't know where I learned it. Nobody ever told me this. But if I sat down to talk to you, this is exactly how I would sit. I'll be trying to send you the message that I'm interested in you, but I'm trying to make sure I don't scare you or that you don't think I'm awkward. So all of this goes into this conversation before I've even said a word. Then I got to know how to say. It's pretty hard. I think it is hard. So we hope that people have more natural skills, but sometimes they don't. So I might have to, like for instance, if I said, have you liked the conference so far? What would you say?
Yes, I'm enjoying it.
Then we're kind of done, right? Now, people with good social skills know, so what are some things that have caught for you? And you might say, oh, there was this terrible lecture on social anxiety that I wish I would have gotten out of, but apart from that, everything was fine. Really wish I would have sat in the back, right? But I have to know how to ask an open-ended question. So if I asked you an open-ended question about your family, and you told me all about your sisters or brothers, and I followed that up by saying, so tell me about your job, those would be two open-ended questions, but if I didn't say anything about your sisters, it would seem really weird. But if I asked you 6 questions about your sisters, you'd be thinking, what's this guy so interested in my sisters for? So, you don't really pay attention to how nuanced this is. And so we have to try to help them. Some of these persons with social anxiety, try to help them. We try to just limit it to a few things to work on and practice it in the office, use some videotaped feedback, have them practice with our support people, and work on a few things. And one of the things we can absolutely work on is one of the things that's really helpful, like for me as a speaker, is to have a few people listening to me and nodding along. Like, you're a good listener. I like talking to you because you look right at me and you nod some. So I'm in the middle of thinking that you're liking what I have to say. Somebody else out there, you might have been looking the wrong way, the other way. I don't want to look at you. So you're giving me this sense that I'm in the middle of hearing what you said. I'd like to hear some more. So we try to help our socially anxious people give those messages. Like, how do you nod? How do you give people that sort of sense that they're doing okay? We practice these open-ended questions, practice the follow-up, do some video recording, and try to rehearse just a couple. If you can get them more rewarding as a listener and teach them some straightforward way of asking an open-ended question and following up with it, but letting the other person talk too, and letting the other person ask the next question. It's sort of like a tennis match. If I ask you about your family, then you've got to ask me about my family. If I ask you about work, then you have to ask. It's a tennis match. So you can't just keep the ball yourself. So all of those things we can rehearse, but we try not to get them all done. And thankfully, a lot of people with social anxiety catch on fairly quickly, and we don't have to do that work. But when we do, then we'll try to do a lot of practice in the office, and we absolutely will not give a litany of hardships. We pick a couple that we think are important. Sure. Both of you.
Do you work with kids?
Yes, I don't personally have a caseload of kids now, but we have an anxiety clinic. Some of our trainees have been grown up into some great anxiety practitioners, and they have different ways of doing this. They do a lot of metaphors and other kinds of work to help fashion the exposure work and different ways of doing the social skills work. They usually cluster the kids together, but we do a lot of the same things.
What age do kids are generally defined certain anxiety symptoms?
It's a teen thing usually. I don't know about diagnosis, but that's usually when it starts to really begin to impact, when people really start to get worried about it. They probably had it earlier. But as far as actually coming in for treatment, there's about a 10-year lag, 7 to 10-year lag between the onset of the disorder and talking to anybody about it.
That's one follow-up question. So do you find that those that do come in, there's a lot of comorbidity with bullying or what they identify as bullying?
Yeah, bullying would be an interesting complaint in both directions. Because interestingly enough, some people with social anxiety seem really scary. You know, those people that you see that you think are aloof and judgmental? Often, now sometimes they may be aloof and judgmental actually, but some of our socially anxious people appear aloof and judgmental, but they're really not. They're not judging you. They just want to cut this short, or they don't know what to say. Do you have a comment?
Yeah.
Mm-hmm.
These kids that you're talking about, especially like as described with that Andy, that he was extremely bright.
Yep.
Successful educationally. Why wasn't it possible for him to assess the situation himself, or any child or any adult, to say, I have this problem, let me watch how other people do it more successfully, and try to integrate that? Like, why is it that they need somebody else to assist them so significantly? Where is the lack of insight into how to mimic or copy? I understand if there are parents, or if there were parents, or had a lack of social skills in the general way in their home life, but if they had some form of a normal upbringing, and some kind of a healthy home, what was it that limits the child from insight into the situation to copy
Yeah.
and mimic their behavior?
So the question came that I think is an interesting question. So how is it that someone like Andy, who had all those intellectual capabilities, couldn't just put a plan in place for himself and get this thing squared away? He could observe other people interacting. He probably had some pretty good social skills. And he could also sort of think, if I practice this a lot, I could learn about the basics. And I do think actually there are many people, probably among many of us out here, who are a little more timid, but we sort of practiced our way out of it, never went to any therapist. And like, for instance, for me, getting anxious about speaking now is hard for me. Although I had to give a wedding a couple of times in the last year, and that was nerve-wracking for me. It was a different kind of speaking. But when I started this, I was very anxious about it. But somehow I just soldiered on. And today I can feel comfortable here. So a lot of us have done that, but it is absolutely clear that for some people, the emotions don't cooperate. They try those things, but they can't get their anxiety down. It just doesn't fall like it does for most of us. And so it suggests that intellectually is not the only route. It's sort of an intellectual problem, maybe. I mean, not intellectually, but it's sort of a higher-order thinking problem, and it's also a bit of a natural problem. So I think that a lot of times people with social anxiety are super frustrated because they get that. They're like, I understand this, but why isn't it working? So often their exposures are too short. They often don't have help with a few social skills, and they don't have a cognitive therapist. Quick question, and then we'll move on. Yep. Mm-hmm. You're the one.
Are there things that we could be doing in the school system that would begin to address it? It sounds like they would be the first ones to see it. And how could we partner with schools with suggestions?
It's a super interesting area. I think it may be one of the more powerful public health initiatives that we could do in our country if we were trying to look at kind of problems in the emotional sphere. Catching kids who are shy in early life, or creating classrooms around performance and practice and interpersonal work, educating teachers about the importance of catching kids who are young and have social anxiety problems. I think it's a great potential area. There are some people looking into it, and we're particularly interested in that as sort of an interesting next step. Yeah.
Just going back to the previous question, you mentioned fear. Distinguishing from something.
It's important.
It sort of seems to me that that's the major issue.
We all have that fear, but for some reason, some people with social anxiety, it doesn't decay like it ought to. Like if you went out in the hallway there and we were doing a little mixing afterward, and maybe you saw someone you hadn't met, and you felt there was something about that person, maybe they were some high status person, I don't know, but you were nervous around them. You would probably have a little timeline in your mind. You wouldn't be thinking about it, but you'd say, I'm nervous now, but if I chat with this guy for a few more minutes, I won't be so nervous anymore. And you know what? Your body would cooperate. And then you get 2-3 minutes into the conversation, and pretty soon you'd be talking just like you would any other time. People with social anxiety disorder, they think that's going to happen too, but it doesn't. It just continues or accelerates. It just doesn't go their natural, their body doesn't operate the same way. So it's a challenge.
Is there anything you mentioned the social skills training? You almost think we have to kind of look at it as normalizing it, because any student, any young person could benefit from social skills training.
For sure. I think any of us, especially as we're entering this really social economy where, what you can say and how you think is probably what you're going to get paid for, not so much what you can lift or move. Last one and we'll move. Yeah. Mm-hmm.
Just thinking about technology really harming it, because, I can't counsel a kid today without them figuring out how to advocate on it. They text, they'll wait a couple hours to see if the kid writes back. They don't know whether they should, how to feel about it, to even go from a text to a call, from the email to a call, from Facebook to a conversation. And it's really hampering.
I think that it's a really interesting issue. The question was, what about this technology? Is it making it worse, better? So here's what I have to say. I think Match.com is great for socially anxious people because it's a lot easier to start that up than it is to meet someone on the bus. So I think that's pretty good. On the other hand, does chatting, blogging, texting maybe interfere with your interpersonal skills development? Probably. And might it also, for some people, soften the distress associated with their kind of avoiding people so they can get some social sustenance and not get out there and really practice? I'd say overall, the technology has been a mixed bag. I do think that for some people with social anxiety, it's a life-sustaining way of interacting. It's at least something, because I do think that people have a sort of a built-in need to connect. What? Yeah, and I think we're probably not helping the social skills development so much for people who are a little naturally not so great at it. I think there are always people who are naturally great at it, and it doesn't matter. They can text all they want, and they know how to talk. Let's move on. So we had the social skills training includes a couple components: the nonverbal social skills, the verbal social skills, and then finally we have, we're still good. We have till 2:45. I thought that movement might be a clear indication. Okay, that's fine. So let's talk about our final type of treatment in social anxiety disorder, which is a relatively straightforward approach, again, and that's cognitive therapy. You know that in cognitive therapy it focuses on your thoughts and how they contribute to how you feel. And clearly in cognitive therapy we're working with our socially anxious patient to help them to catch their thinking that contributes to their fear and have a way of responding to it. The idea is to join together against a common enemy, their thoughts. And they have several different kinds of thoughts, as you're, I'm sure, aware of in your work. Magnification would be terrible if I didn't know what to say. Really, you could see it in Larry's story. Don't be gutless, don't be chicken, don't make a fool out of yourself. I mean, for a lot of people with social anxiety, what would be an awkward moment for you, it really feels terrible. So a cognitive therapist kind of helps that client pay attention to that thought, like this was a disaster, this was awful, this was terrible, and say, well, hold on a second. If it was a disaster, wouldn't my life have changed a ton? Like if you were on the way in, you say, Dr. Himle can't make it. He's had a disaster in his life. It was an awful, terrible catastrophe. You wouldn't think, oh, well, what happened to him is he talked to somebody in the hallway, and they were kind of short with him, and it broke off quickly. You'd think somebody got ran over by a truck. You'd think that, my kid got killed, or I had a heart attack, or got attacked or something. You wouldn't think that a social event would be would meet muster as a catastrophe. So a cognitive therapist would help them to sort of catch those thoughts and respond to them. A big one in social anxiety is all or nothing thinking, like I made a complete fool out of myself. Whereas, for instance, if I had a lot of social anxiety, I could think to myself, well, how'd the speech go? People with social anxiety would often pick the 2 or 3 things that didn't go well and think and just ruminate and ruminate and ruminate and ruminate about that. And then when you ask them, how did speech go? Terrible. It was terrible. Mind reading, huge in social anxiety. He looked away, he must think I'm weird. They cut off conversations a lot just by little cues, judging that person's in the middle of rejecting them. As if it is terrible to extend a conversation with somebody who'd rather go to the punch bowl. I mean, obviously, we've all had extended conversations with people who wish they were in the punch bowl and they're still talking to us. That's just part of socializing. And I think most of us know that we've been in conversations with people where we probably let it go a little longer than they wanted to. And most of us would say, oh, well, that's part of talking. We go on about our business. For people with social anxiety, it's a bigger event. And a cognitive therapist is trying to reduce that distress. Fortune telling is a huge one, and that's a big reason why so many people with social anxiety avoid interactions, and that is, why bother to try? It just won't work out anyway. So we're using several sources of information to help people with social anxiety do a little better in catching their thinking and responding to it. Like, for instance, and I would just suggest, I'll kind of close on this part, and that is, if on the way out somebody stopped me and said, that was the worst presentation I've ever been to in the history of this place, you are an idiot. I would probably take 2 or 3 steps after that, and I'd say, wow, that was terrible. It was really awful talk. But then I would probably get 3 or 4 steps down the hall, and I would begin a self-defense. I said, well, hold on a second. I said several things during that talk which weren't so terrible. I said this, I said that, I said the other thing. How does that person know I'm an idiot? I can do several things well. Maybe the talk didn't go as well as I'd hoped, but that doesn't make sense. And who is this person? They're probably odd anyway. They must have something wrong with them. I'm actually a pretty good speaker, and go on about your business. That's a style of catching your thinking and responding to it. And I suspect that we all do it all the time. We're just trying to help our socially anxious clients get better at it. They already have some skills in noting how they think. We're just trying to help them through writing, through conversation, to be a good thought catcher, and to respond to it well. So almost always in social anxiety treatment, we got these three components together: exposure therapy, cognitive restructuring for sure, and for people without kind of good natural skills, some social skills training. Those three things together, usually delivered in weekly sessions, either in a group, which is really nice, or individually. And you can see this is a meta-analysis of a range of different social anxiety projects where cognitive behavior therapy was used. And just the short answer to this is exposure is the king. That's the most efficacious part of the treatment, followed by the cognitive therapy and some of the social skills training components. But often the three are used together. So we have good scientific support for the value of CBT in the treatment of social anxiety. That doesn't mean it's the only treatment that would help someone, but I do think a person with social anxiety deserves an early shot at it. They ought not to get years of treatment that isn't evidence-based to start with, and that's what most people get. So it is by far not a panacea. Many of our clients do well, some don't, but they ought to get it first, I think. This is another slide just basically talking about the difference between medicine and social anxiety, medicine and CBT, taking together meta-analysis, meaning again gathering together a bunch of different treatment studies. And the short run here is that medicines are also helpful, and when they're combined, they're a little more helpful. CBT and medicine together are a little more helpful than medicines alone. The main medicine for social anxiety are serotonin reuptake inhibitors like our friend Paxil, Prozac, Zoloft, etc. Some people use benzodiazepines like Xanax, for instance, although we try hard to avoid those in our clinic because we think it interferes with exposure and can also develop some dependency problems. Old drugs called monoamine oxidase inhibitors are tough. You can't eat fermented foods, but they're very powerful for social anxiety and a good sort of third-line medicine. And for some people who have short performance problems like piano recitals or speech, a beta blocker that slows down their heart can be a potential medicine solution. But for most people with social anxiety disorder, cognitive behavior therapy is the first phase of treatment, and to consider combining that with a serotonin reuptake inhibitor is a second line of treatment. And for the future, there's just some people who need more. And that's where so many other interventions might be helpful also. So, thank you so much for listening to me, and thank you so much for being a good sport, because I really worked you over today. But I hope we kind of leave with these takeaway points. Social anxiety is common, impairing, early onset, lots of other psychiatric problems collect with it. Cognitive behavior therapy is a good first-line treatment. Medicines can be helpful, quite helpful if they're combined, and certainly other treatments can be used if those things aren't tried first. But I do think from a social justice perspective, our clients ought to get first what has been shown to be most effective. And I think there's some interesting ways to deliver the psychosocial treatment with technology, and also to do a better job in training practitioners on these relatively straightforward concepts. So thanks very much.